Good afternoon, and welcome to Everybody, the podcast which shares stories that highlight people in life, that make the world an interesting place, which ultimately ties us all together in unique and wonderful ways. And who am I, you might ask? I would be the head wrap socialite, wife, mom, micro-influencer in the fashion and etiquette world. But on this podcast, I will be introducing you to some people who I've had the opportunity to meet along my journey, who have helped enrich me in my life in beautiful ways, and who I hope will do the same in yours. On today's episode, I have the pleasure of sitting down with my friend, Dr. Tufia Haddad. Tufia is a wife, a mother of 3 incredible boys, and a trailblazer in the world of medicine. We have known each other for over 13 years, meeting when our oldest children were classmates. We've cheered many a soccer game from the sidelines as our young men are also teammates. What inspires me about Tufia is that she is a guiding light, and she champions the voices of women, igniting the spark of possibility in those who dream of making their mark in the medical profession. So, dear listeners, please help me in welcoming my friend, Dr. Tufia Haddad, to today's episode. Tufia, thank you for being here.
Oh, thank you so much for the invitation and the kind words.
Tufia, could you tell the listeners a little bit about who you are?
Yeah, well, boy, it's funny how little time I sometimes take to reflect on myself and a seemingly simple, easy question to describe myself. Well, I guess I would start by saying, I was born and raised here in Rochester, where I'm now raising my family. It's such a fantastic place to be a kid, to have a family, to raise a family. And I was the oldest of 3 girls. And still have very close relationships with my sisters.
Mm-hmm.
I knew I wanted to go into medicine at a very, very young age, probably first grade or so.
Wow.
And I'm always asked, oh, well, was your father a doctor? I'm like, no, he was not. But my mother was a research technologist at Mayo, worked in a laboratory. And so I remember just kind of growing up being exposed to the laboratory. I'd be able to go in on weekends or some evenings when she had some experiments to keep going. And I was just fascinated by it. Loved science, always curious. And having the exposure in Rochester and Mayo Clinic in that community at such a young age really helped to shape who I am. As a senior in high school, my mother was diagnosed with stage 4 breast cancer. And at that time, I had no idea what that meant. She would get some treatment, she would get a little better, and I did not know that her disease was incurable. And about seven and a half months, just a couple of weeks after my high school graduation, she died of breast cancer. And it goes without saying that has shaped a lot of who I am today. And like I said, I always knew I wanted to go into medicine after that experience.
Right.
I really wanted to prevent cancer. I wanted that to kind of be my specialty. But ironically, I went through my training. I always thought doing cancer medicine or oncology would be too close to home, would be too hard, would hurt too much. And yet my very first rotation, taking care of my very first cancer patients during my training at the hospital where my mom passed, it just felt so right. I connected with patients, I connected with families, and I felt like I was doing something. I had the power to actually do something, make a difference. That's something I didn't have watching my mom go through that experience. Yeah, and my mentor attending on that rotation kind of sit me down. He had only worked with me for about 3 days and, just said, you're an oncologist, right? And that kind of set the path forwards. Medicine is a lot of who I am
Right.
now, cancer medicine. And that's one part of me. And then the other part of me is, a wife, a mother, 10x harder job than being an
Yeah. Right.
oncologist. But I love it. I love raising my boys. They are my highest highs and my lowest lows. But it's such a gift, such a blessing. I do not take it for granted.
Right.
I love raising boys. I feel like I was born to raise boys, even though I grew up in an all-girl home.
It's not something.
I don't know how that happened, but that's where my dad, I talk about my mom, and, she was such a go-getter,
Right.
multitasker, inspired everyone around her as well. My dad, on the other hand, was always the one to just sit us down and, put records on, and
Right.
we'd listen to music. We'd listen to Bob Dylan tunes and Simon and Garfunkel. And, that was kind of the soundtrack of my youth. And, just to slow down, stop and smell the roses, feel the
Right.
sunshine, feel the breeze, be in the moment. I remember just kind of stargazing with him as a kid, too.
Wow.
It's like a really fantastic memory. It's a beautiful cloudless night, just to put the blanket out on the grass and just look up at the stars. So I have that balance from my mom and dad. But in talking about my dad, I think once he realized he had 3 girls and will always have 3 girls and no son, I just kind of gravitated towards spend time, watching sports together, Minnesota sports, by and large. But it was just kind of our bonding type too. If it wasn't something out in nature, outdoors, or listening to music, it would be watching sports together. So I grew up just loving sports. The North Stars roster as 6, 7-year-old girl,
Right.
and cherished my autographs from hockey players and everything. So I think that was sort of, helping me shape me to be the boy mom I am today.
Exactly. And as you mentioned hockey, I was thinking and now your boys have all played hockey. Did you kind of push them into that, or?
It's interesting. Sort of,
I
yes.
love it.
It's funny. I still laugh. How my husband and I met.
Do tell.
Oh, gosh, this is so funny. So we met on Match.com in 2002, which I think was just a year after Match.com was even a thing. And I was like, how am I going to explain this to my grandma? It's funny. I didn't have a profile, whatever. But I was single.
Right.
I was a resident here in Rochester. I'm like, I'm going to be single the rest of my life if I don't try something.
Oh, goodness.
My cousin told me about it, bless her heart. And, there I was just scrolling.
Right.
And, came across this profile. And, it's fascinating what someone can say about themselves, in
So question
2
for you.
sentences.
Did Kev have a picture?
He had a picture.
Okay.
And it was actually him.
Okay.
It was actually him.
Okay.
But, it was just he wrote about work-life balance, being outdoors, I think something about red wine, and
Love it.
And he had Minnesota Wild, season hockey tickets. I'm like, check, 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 check.
That's fantastic.
This is great. So I paid $25 so I could email him. So I paid $25 just to get the email, make that connection,
I love it.
which was great. And then he's like, well, send me a photo. And I'm like, okay. So I had to go to Best Buy to get a scanner because this is 2002. So I paid $125 to scan in the best possible photo I could find of myself.
Great.
But yeah, it's so funny to look back and share that story now when people meet online all the time now. But yeah, back then it was. So we've had season tickets when we were living in Minneapolis. We had season tickets.
Nice.
So yeah, we're both huge hockey fans. So it just was inevitable. Our kids are all going to be on skate.
There's so many questions that I have for you, and I'm thinking which way do I want to go? But I will reel myself back in because I
Yes.
want to delve more into the story of like the Best Buy and, the Match.com. But that'll be for later.
Of course.
If we were to talk about your journey to becoming a breast cancer oncologist, and I remember you had said in your introduction how you didn't know if that was the way you were going to go in your medical journey. Have you found healing in that?
Absolutely, 100%. I will tell you, having lost my mom to breast cancer, I would say those initial, actually probably several years, just had so much anger, much anger.
Yeah.
And the 5 phases of grief. Yeah, I was stuck on anger for some time.
Right.
It was really interesting. Someone finally, it was a professor actually. I went to college at Marquette University in Milwaukee, and it was actually a professor there who I remember I had to go home to help my family. Our family went from 5 to 4 to 3 very quickly. My 2 younger sisters and my dad back home. And I remember just telling my professor I had to go back home to help my family. I was going to miss an exam. And he ended up just having a conversation with me and gave me, I shared with him what had happened, lost my mom, and I need to go help my family. And we just started talking, and he said these words. He, basically gave me permission to be mad.
Right.
And I think part of that really came from my mom wanted to protect us so much. She wanted us to, live a normal life. She wanted me to have a normal senior year of high school. Right. And she didn't want it to be about her. She really didn't tell us how serious her disease was. I would say the same. My dad none of us really knew how sick she was. And that's where, it really wasn't until her last 24 hours when doctors finally told us, that she was, in the phases of dying. And it wasn't until those 24 hours before she passed that I knew she was dying. So I had a lot of anger that, she withheld that from us, and I know she did it from a place of love. But gosh, I wondered would I have done things differently, spent more time, said, have the opportunity to have those conversations, had more time to say thank you and share my gratitude. And so, I definitely coming out of that was really challenging. So, fast forward through my medical training and landing on becoming a breast cancer oncologist, there's no doubt that it has been a healing process to take care of patients, to see the advances in medicine, and breast cancer oncology. And the vast majority of my patients, are survivors and go on to live, full lives, transformed but full lives. That is so rewarding. But to also help those families, the women and men, who have incurable disease, to help them through their journey, help their families through that journey. And that's such a blessing as well. So. But also to be able to engage in research, that has been so fulfilling as well, to be part of the solution, right? To contribute to advances in our knowledge of why it happens, the risk factors and ways that we can better screen and prevent disease, better treat the disease, more cures, fewer toxicities. We're looking for those types of advances. So to be able to participate in that research community, that also is very fulfilling and a different way that I can contribute, really. And I think it really honors my mom as well, because she was a scientist at her core too. And
wow, it's as you share your story with me and the listeners, I feel like your compassionate heart, and I think about the patients that you're able to help because you understand a lot of what their journey is, and you're able to show them with the beauty of who you are and who your mom was, how to walk this path. And I know, there are There are people who do their profession, who do it, but there are people who live and love their profession because of the life experiences that they've had.
It doesn't feel like a job to me. It's a blessing. I feel grateful for, this gift. It really is a gift. I don't take it for granted.
Right.
My patients are my family. They are my sisters. I treat each of them as if they were my sister. And I don't know what it is to walk in their shoes, but it's just really, my mom's sacrifice and all that she endured.
Yeah.
I know she inspired so many as well at work. She changed a lot of people's lives.
And you carry
in
that
a beautiful
torch.
way.
And you carry that torch, and you're doing it in your way.
Yeah. And my hope is I can continue to inspire women in medicine as well. And I think that's a big part of where that drive comes from. My mom, what she did and how she empowered other women around her. She volunteered, in the community here as well, and, helped young children who needed that, role model and that bright light in their life. And just to be able to continue to carry that forward, pay it forward. That is one of the most fulfilling things in my job as well, is helping to support and empower women. And
that's beautiful. Thank you for sharing that.
Absolutely.
As a wife, as a mother to 3 busy boys, right? I should say busy young men. How do you manage in the midst of it all to strike a balance between your professional and your private life?
Yeah. I don't know that I have figured it out. Every day, every week, I'm learning, that's for sure. I think I have tried to let go of holding myself accountable to that balance, so to speak. There are going to be days and weeks where I need to be more present at home or more present at work, and it ebbs and flows. So I would say that the couple things that I do to try and keep some semblance of balance, when I am home, generally speaking, I put the email aside. I put the pager aside. I am there. People know I'm terrible at text messaging. You probably know this too, right?
No.
I never have my technology around me when I'm at home.
Right.
And I do my best to just, not only is that a good thing as well, but just try to be sort of technology free. Like when I'm home, I am there for them. I love to cook. I love to be in the kitchen. That is how I decompress. Give me a sharp knife and a bunch of vegetables and a cutting board.
I love it.
Therapy. But I love even the way we designed our kitchen. I made it so that the kids are there doing homework while I am prepping meals, and we're having conversations about the day, and people are coming and going during the school year. It's total chaos, don't get me wrong. But I think when I'm home, I am home. When I am watching their soccer matches, I am watching their soccer matches. I'm not on my device. I'm not, I don't even talk to some of the other parents.
Yeah.
I don't want them to think I'm standoffish or whatever. I'm there to watch the game and to watch my kids. And I just really try to be present. And even if they don't get a lot of me on a busy work week, the time they do get, I try to make sure is high quality. And same thing on weekends. So I think that's how I try to balance and make it work, is just to be present when I'm with them. So
I love that.
Yeah.
The beauty in the chaos. I love it. And since you mentioned, I'm going to veer off a little bit, but since you mentioned cooking, what is your favorite dish? Do you have a go-to dish that you cook Or do you like to mix it up?
Oh, I totally mix it up.
Oh.
Like, we have something different every day.
Oh, you're I should
yes.
come over.
No, I mean, I love to cook. Like, thankfully, I have great eaters, not
Yeah.
terribly picky, and it can be anything. It could be seafood one day. It could be tacos one
Oh,
day.
my goodness.
It could be, stir fry or pasta.
Okay, what's on the menu for tonight?
I was just looking this up actually before I came over. We're gonna do Korean style sticky ribs.
Oh my good. Okay, those are my favorites. So, dear listeners, I will be taking myself and my family. I've just invited myself and my family to your house tonight for dinner.
No, I made them once, and they're like in the slow cooker, and oh my gosh, they are magical.
Okay, we're going to need you. I'm speaking for me and the rest of the listeners. We're going to need you to give us this recipe so we can post it with your episode.
But yeah, I love it because I think my boys see me in the kitchen as well. They've started to pick it up. And all of a sudden, my oldest is like, knows how to make steak.
Oh, I love it.
Really good steak. And yeah, he just dove right in, and watching him, cook and add spices and flavors and garnish and like care about how it's presented on the plate.
He plates it.
So my son. I love this kid.
That's awesome. I can see him walking around the kitchen as he's cooking with his napkin and wiping off the plate as he presents it to the family. That's fantastic.
Totally. I'm like, oh, yay. Praise. Oh, nailed it with this one.
Besides cooking as a way that you use to decompress, are there any other hobbies that you enjoy?
Yeah, it's interesting. I find myself, this is like really bizarre to admit, but I feel guilty when I am like just spending time on me. And I know I shouldn't. There's absolutely no reason I shouldn't. And I would tell other people, take care of yourself.
Yeah, for sure.
Make time for yourself. And, even sitting down to read, like about 20 minutes in, I'll be like, gosh, I really should be, out doing something else or whatever. So as silly as that sounds, I don't have like go-to hobbies outside of cooking. But what I do like is spending time outdoors. That to me is so grounding. It doesn't take me long to just be completely lost in the moment and just like my dad raised me, right?
Yeah.
Like feeling the sun, feeling the breeze, walking in the tree. It's that's what I enjoy most. That's what absolutely grounds me. Another way that I decompress. So it could be on a bike, it could be a hike, but yeah, just being out in nature.
Do you still find yourself stargazing?
Yes, absolutely. I can absolutely get lost.
Favorite constellations?
Oh gosh, I'm not that good. No, it's just gazing. There's no looking for specific, and it's just gazing, really. And I've tried to pull the boys, out on the deck or out on the grass to do that with me, especially on great summer nights like we've had.
For sure.
Or when there's the electrical storms and cloud lightning, I'm like, hey, we're sitting outside and we're going to go watch this. And it's great. Like, they get it.
That's so good.
They get it, too.
And it's beautiful, too, because they will use these experiences, right? And they'll take those with them when they go off to college and when they get married, even though, it's like, it seems like it's so many years down the road.
Well, I've watched it with you. Oh my gosh.
We're going to blink our eyes and then...
I know.
Our kids are going to be us.
But I remember that, one of our first, soccer matches with, Jack and Zion when they were so young and adorable. Jack is my oldest, Zion is your youngest. And then you had these three other just beautiful older boys. And I was like, that is my future. They like Jay and Trina are, 5 to 7 years ahead of us. And just watching them grow and watching you launch them.
Yeah.
Wedding.
I know.
Like, that happened really, really quickly. Like,
I know. And
there's our future.
I know. And it's like, you look at our boys, now they're juniors. It's like, what? Then you have a
freshman.
And then
6th grader. Yes.
Unreal.
These years are so fun, though. Watching them become these young men
Yeah.
and having conversations with them navigate those transitions and helping navigate the crazy world we live in. Help them, look ahead, enjoy the now, but looking ahead and they're busy years, they're crazy years. But boy, if I could freeze a moment in time with my kids, this would be the phase. This would be the phase that I am just loving the most. But I've said that before too.
Right.
So
I know.
Who knows, maybe 10 years from now, I'll say, this is the best phase.
Exactly. Do you ever find yourself, and sometimes I find myself, looking back and saying, oh my goodness, I hope that I enjoyed every season, because they go so fast. But when you're in, like you said right now, you're enjoying this phase. Did we say that when, I'm sure we did, when they were in kindergarten and first grade, fifth grade, and it's just like, but then the years go fast that you can't remember, was I really in that moment with them?
I know. It's funny to look back because, from like 0 to 3, 4 years old for each individual boy, I'm like, I don't have a really strong memory. Those years were just so busy. And so cognitively, mentally challenging, tough. Those are tough years. And very little work-life balance. Trying to, manage with really young kids. It's fascinating. But I do remember, like, once they hit kindergarten and they started reading and they started, having these incredible thoughts and the creativity and having conversations about how they see the world. Like, I remember loving that phase too. And just the unconditional, unbridled love they have for you at that age, right?
Exactly. But they have that same love, I've noticed, within your boys for each other.
Yeah. It's interesting, the dynamics and how they change over time. And especially with 3, it's like a couple always kind of pair off and have a little bit better relationship than, this pair. And changes and evolves over time. But I have no doubt they have each other's back. And I'm very grateful for that. They're good boys and they do care about each other, even though they show it in the most bizarre ways sometimes. I know it's there. I know it's there within them.
That's fantastic. We're going to go back a little bit. Like I said, I have a lot of questions for you. When you talk about oncology, can you share some of the insights or the innovative care delivery models you and your teams are working on now, especially since we're now in a highly digital age?
Yeah. It's interesting. When I first became interested in leveraging digital for patient care, it really came out of a place of need for patients. I shared earlier, I am very blessed and very fortunate with all the advances in breast cancer research that the vast, vast majority of my patients are long-term survivors. And it is the most beautiful problem to have as an oncologist. But the issue is we don't have enough oncologists to take care of all these survivors post-treatment. And I kept asking every year, I'm like, we need to hire another we need to hire another one. And finally, I'm like, okay, this is not sustainable. There are not going to be enough. We have to think differently and care for these patients post-treatment differently. And candidly, we are trained to treat cancer. We are not always experts at managing the side effects or the toxicities or some of the long-term surveillance, late complications of therapy, the psychological aspects post-treatment. So it was kind of the constellation of those things where I'm like, we have to do things differently. They deserve better. They need more. It's well recognized that, cancer survivors' needs are very often unmet post-treatment. So that is how, we actually created a digital kind of app-based care plan to help support breast cancer survivors after treatment. And our goal was to be able to remotely monitor these symptoms and side effects and to be monitoring for recurrence or late complications of therapy. But the goal was to have engagement of primary care physicians and to have them engaged in that post-treatment management and in surveillance, but to still have the oncologist expertise when needed to help assess or treat and manage. So that was kind of the goal, to kind of decompress the clinic so we could make space for new patients, but to still keep connected with them, to not just, discharge and say goodbye, good luck. It's we wanted to still be engaged. We want to still be there.
Yeah.
But for the majority of people who are doing well, we don't always have to see them back. Their primary care, women's health specialists do a phenomenal job helping to support and manage post-treatment. So if we could transition more of that care to that practice, again, it would enable us to see and take care of more new patients. We knew the cancer incidence, especially for breast cancer, is going to continue to rise as our population ages. And that's, we need to be able to support the new patients too. So that was kind of how I became interested in remote patient monitoring. And, I really postulated back then, this was 10 years ago when I first became engaged in the space, actually even before the technology was there to really support this model of care. But I was absolutely convinced. I'm like, they're going to have better symptom control because we don't monitor. Historically, we haven't monitored them in between once every 3 months or once every 6 months or even annual visits. Now we're actually doing that. We're actually monitoring and providing in-between visit care. I'm like, I'm confident they're going to have better symptom control. We're going to potentially reduce the cost of care by not bringing everyone back on a fixed basis. So it was fascinating to see some research come out shortly after we were creating and getting ready to implement this app-based care plan. There was a group who had a similar concept. They were working in the lung cancer population, and what they showed is that form of weekly symptom monitoring, remote monitoring through the web, internet-based symptom monitoring once a week. Something as simple as that gave the patients better symptom control, better control of their symptoms. They actually lived longer. Their survival was significantly improved. And there was a reduction in the cost of care. And I'm like, yes, that's it. Like, this is what we want, right? We want our patients to feel better, have a better experience, live longer, and then help bring down the cost of care. So it's to be able to help lead that now. I led our remote patient monitoring program from 2017 to 2021. So we were implementing this, before the pandemic, and not just for cancer. This was broadly for heart failure management, for diabetes management, other chronic conditions. And then we did it for post-hospital, post-acute care. And then for oncology, we grew the care model out for patients who are having complications from their chemotherapies. And we consistently show in our research that this type of care delivery, again, we developed a remote monitoring program for COVID-19. We knew that we did not have, hospitals across the country, around the world, didn't have capacity to care for all the patients. So we very quickly took our framework and adapted it for COVID-19. We're like, okay, we're going to do monitoring of high-risk patients who are at high risk for severe COVID, and do the remote monitoring, have the devices in the home to be monitoring vital signs, objective data, to have them reporting their symptoms twice a day. And, we showed that the patients who were monitored versus those who had risk for severe COVID and who were unmonitored, when you balance all the, make the groups as equal as possible, the patients who were monitored, again, had better outcomes, less time in the emergency department, less time in the hospital. If they went in the hospital, there was less need for ICU level care. And we really believe that, by doing that remote monitoring, you're able to earlier identify when things are not going in the right direction. And we could often intervene with really simple interventions to help change that disease trajectory and help keep them in the home. Or again, if they needed to go into the hospital, it usually was a short hospital stay that, didn't require the ICU as frequently and lower mortality rates. It's exciting to see that research now is starting to really drive transformation of healthcare.
Yeah.
And we're not just using digital because we're in this digitally enabled world. We're using digital to improve, like I said, improve the patient experience, improve the clinical outcomes. How neat is that? That it's not a new drug, it's, or not a new drug with it's super expensive or comes with a lot of side effects. It's just changing how we care.
Yeah.
That can improve a patient outcome. So that's exciting to see that continue to grow, and healthcare policy and reimbursement models are starting to align so that we can, continue to disseminate this model of care, but very patient-centered, trying to keep more care outside the hospital and clinics and in the home environment.
I love it. The transformation of, the digital age.
Yeah.
Like, this is amazing to see the trajectory of where healthcare will go in the next 5 years, because it's happening. It's happening.
Absolutely. And, that I think has been one of the silver linings in medicine coming out of the pandemic, because there aren't many.
Right.
There have not been many silver linings, but this was one of them. Just a really accelerate the adoption of telehealth and virtual care and practicing differently. And all these things, there's a lot of concern that it would be a lower, quality of care, right? We're showing just the opposite. And generally speaking, patients have a very good experience. They want more.
Yeah, and this technology that we're seeing too is for the greater good. And you can see that. With you talking about your patients, I would like to ask you, how do your patients inspire you on the daily?
It's interesting. So many do in so many different ways. Sometimes they inspire me professionally. Sometimes they inspire me personally. As we have conversation about being a mom of boys, I have several patients who are moms of boys, and I will tell you, sharing stories with them. Those are some of my favorite ways in which I'm inspired by my patients, or sharing recipes, or, it could be anything. There's so many different ways, but I think generally speaking, just watching them go through such a life-changing event, everyone copes differently. Their bodies, their minds, their relationships. Observe and, be witness to this for people over and over. It inspires me every day. I had a patient who just recently came to Mayo because of a clinical trial opportunity. And she shared with me, I'm doing this because, I want to contribute to research. I need the world to be a better place for my daughter, who was just diagnosed with breast cancer, and her daughter was in her 20s. And I was just so choked up because, here she is, already so young herself, and, wanting to engage in research, participate in a clinical trial to help advance the knowledge for the next generation, including her daughter, who had. So, it's stories like that absolutely inspire me. And I think inspire all of us in the research community. So many of us have all been touched by cancer in some way. Almost everyone has a story who's in the cancer research or oncology community. But the patients, again, inspire us day in, day out.
Thank you for sharing that story.
Absolutely. Some of the research that I'm engaged in, I loved, like I said, as a little girl, I loved being in the lab. Actually, I worked in a laboratory for 2 years in between college and medical school, and had that firsthand lab experience, and I absolutely loved it. I loved it. But I was always like, but what does this mean? How does this translate into human beings? It's cool with, the cells and all this, but how does that impact humans and human health and human disease? So that's what, again, just validated, yes, you need to go into medicine on the people's side of research. But I feel so fortunate to have had that experience, because that's what my research is now. I partner with basic scientists who do the work in the lab and, are evaluating new treatments. And I help translate that
Wow.
into a clinical trial to evaluate these new drugs and new therapeutic approaches in people with breast cancer, with drug-resistant disease. So to see that those lab experiments actually translate into treatment option, I feel very blessed to be able to engage in research. We call that from the bench to the bedside. It's really fascinating to be evaluating these new treatment options in clinical trials.
As a female leader in medicine, how do you empower? Because that's one of your jams. How do you empower and support the next generation of aspiring female professionals?
So I guess I would always say I always try to lead by example. And I think that's at work and at home and everywhere, is to try and lead by example. I try to be as accessible, approachable as possible. And I've had daughters of my patients come shadow and follow me in clinic. And just the ability to share that experience and inspire, hopefully inspire them too. That is one of my absolute favorite parts of my job. So I try to just kind of have that open door, love to help advise. I can't possibly be a mentor to all, but I do try to be an advisor to as many people as I can. So just to kind of help them talk through decisions they are making. It could be about what specialty to go in. It could be, do I want research to be part of my career, or whatever it might be. I just try to help coach, honestly. Kind of help coach people through those decisions along that career pathway. So as a leader, though, that's where, we still have a long ways to go in medicine. We do not have enough, women in leadership roles. But I think that will change. What I hope to see is more diversity in leadership roles. And I think it's coming. The efforts and intentions to be more inclusive in leadership. I see it happening, and I have hope for that. When I'm in those circles, whether it's recruiting or hiring or faculty development or actually sitting on a search committee who's helping to, hire or bring in a leader, having the ability to establish a search committee that is diverse and representative, because you need that at the table in order to ensure that we have more women,
for sure,
more, racial ethnic minority leaders. It won't happen unless we are intentional.
Amen. And there can be people who talk about it, and there can also be people who be about it. And I am grateful, that you're one of those people who are about it. And you are taking the lead and taking the charge and inspiring change. So thank you, my friend.
Yes. Oh,
thank you, my friend. With your expertise and experience, what advice would you have for families that are going through a diagnosis of breast cancer?
Yeah. I think, if I could give advice, sometimes I'd be like, well, is it the best advice, or is it just me through the lens of, my experience being a family member? But being open, communicating with your family, communicating with your friends. I think that is such an important thing with the new diagnosis is, or well, a lot of my patients have said, that having that transparency about the disease, helps the people around. It makes it a little less scary.
Yeah.
For some, sometimes it can make it a little more scary, especially for younger children who may not be able to process everything. But I still encourage them to talk with their children and talk with their family and their loved ones. Be open to help. Be open to help. There's so many people who want to help but don't know how to help when a friend or a loved one is diagnosed with cancer. And sometimes people will pull back. And I see that happen time and time. I saw it happen with my mom, and I see and hear it from my patients too, that when people don't know what to say or don't know how to engage or how to help, they sometimes will just completely retreat.
Yeah.
And that's a scary place to be, is to feel some of that abandonment
Right.
when you have a new diagnosis, especially if you have incurable disease.
Right.
So I encourage people to, again, have conversations, pull those people in, and talk candidly
Right.
about it. Find ways to bring in help and resources to get through it, whether it's help in the home, help managing the kids, help in the day-to-day, help with meals, whatever it might be,
Right.
just to ease the burden of going through a diagnosis and treatment, but also allowing those people who want to help, to participate and to be
Right.
part of helping you through that
Right.
journey.
Thank you.
Yeah.
Thank you. And with your expertise, can you give us, your listeners, some practical tips in promoting, I guess, early breast detection awareness?
Yeah, definitely. Oh gosh, I just felt myself like light up with the opportunity. There's such a misconception that I'm only high risk if it's in my family. And the important thing is for people to know that 75% of people, largely women, but also men who are diagnosed with breast cancer, do not have a family history.
Oh.
And it's possible you are at higher risk for disease even without a family history. So I encourage all people to, if you don't have a primary care provider, to find one or a women's health specialist and there are dedicated breast clinics at many of the larger medical centers as well, where you can have your risk assessed. I think that is one of the most important things, or a message I could communicate, is know your risk.
Okay.
For example, women who have dense breast tissue on their mammogram, and it's not dense breast tissue how it feels, it's actually on the mammogram images, where the density of the breast tissue is, the radiologist is able to, look at the mammogram and assess, using the software to assess the density of the breast tissue. And women who have dense breasts by mammogram are at a 3-fold higher risk of developing breast cancer. And a lot of women don't know that.
Right.
So, those are the types of things and reasons to have that conversation with like I said, either a primary care provider, women's health specialist, a breast specialist, and especially if you have a family history, any family history of breast or gynecologic cancers. It's important to have your risk assessed. That risk assessment then can help, influence with or right size the screening program that's right for you. And we still recommend annual mammograms starting at age 40. If you have a family history of breast cancer, you may need to start your imaging at a younger age.
Okay.
But if you are at higher risk for breast cancer, you will qualify for additional, what we call supplemental imaging. So other imaging technologies that are more sensitive than mammograms, complementary. They don't replace mammograms, but you may qualify for additional screenings. So the nice thing as well is, by having those conversations, you also will have the ability to learn about, research for better screening. We are working on blood tests that can pick up tumor DNA. And those blood tests are really the future of cancer screening as well. And so I think we need more research yet to not only improve the tests, but also knowing what to do with a positive test, So there are research, opportunities, and we need everybody in. And we want to be inclusive in that research as well, so that how we screen is representative of our entire community, not just specific cohorts. But yeah, for screening and for prevention strategies as well, there are many great research opportunities. So that would be my single piece of advice.
Thank you, my friend. No, that was wonderful, because I think we all need to hear it, because a lot of times I think, myself included, that certain body types, or oh, I don't need to go in and check. Oh, I'm not this age, even though I may have had a family member who has had this disease. So it's nice to hear, and it's good for all of us to hear, to also reinforce at the age of 40, go get your mammogram done, whether or not you're a man or a woman. Also, if you have a history of family breast cancer, it is a good idea, along with your healthcare provider, to go in earlier. Don't wait until you're 40.
Yes. Get that assessment early, so that you can have a personalized, a tailored screening and prevention plan. We have medications that have been shown to reduce the risk of developing breast cancer in women who are at high risk for breast cancer. So they are so underutilized.
Right.
So underutilized. They're incredibly effective, and yet uncommonly utilized. Why? Because people are not getting their risk assessed, In part, that's why. But nonetheless, it's so important.
Thank you. Thank you for that information. We're going to bring it back. So I know from conversations that I've had from you that you are a music enthusiast. You're like, where are you going with this? Where are you going with this?
I hope she doesn't say cheerleader.
Oh, that's coming. We're going to save that to the end. So listeners, I would say listen after the closing is done. But we've heard that you're a musical enthusiast. I know that you're a musical enthusiast. What's your favorite song?
Oh, gosh.
Or what's your favorite music genre? Because I know you guys like concerts.
I love the music of the 60s. I do. It was the music I was raised on.
Yeah.
I still gravitate to it today. I try my best to share it with, my boys as well. My youngest, Bo, bless his heart, asked for a record player for Christmas this past year. I know. How cool is that kid? And some of the first albums, he just fell in love with Bob Marley.
Oh, my goodness.
I know. And, we were just singing. In fact, I have 3 little birds. I was singing it earlier today.
I love that song. Okay.
I know. Yes, I would say that is the genre.
Okay.
That was the music I was raised on.
Simon and Garfunkel, you had mentioned them earlier. What's your favorite album or song?
So song, that one is very easy because my dad used to sing it all the time. In fact, we put the lyrics after he passed, the little prayer cards.
Yeah.
We actually put on the back the lyrics to the 59th Street Bridge song. So that is the slow down, you're moving too fast. You got to make the morning last, just skipping down the cobblestone. I love it.
Oh, I love that, my friend.
Yeah. Life, I love you. All is groovy. I just was like, gosh, like I said, that was my dad, slow down.
Yeah.
You're moving too fast.
Yeah.
So I still try to live by those lyrics especially when I find myself just working too much.
Yeah. And dear listeners, you can see why I just love this woman. There are certain people that hold, just a really, really special place in my heart. And you are one of them. And I have really enjoyed this time that we have had together. And I want to say, as we bring this captivating interview to a close, we find ourselves, like I said, I love this woman, in the presence of true inspiration. Tufia Haddad. She's a wife, a mother, and a woman whose passion for medicine inspires others on a daily basis. She's a beacon of hope. She is a woman who advocates for other women and allows their voices to be heard in the medical field. She knows that the transformative impact that diverse perspectives can bring to the world is healing. Her life and work remind us in the power of empathy, the resilience of the human spirit, and the profound impact one individual can have on the lives of many. My friend's journey inspires us all to embrace our own unique paths and find strength in our shared humanity. So thank you, my friend, for being a part of this episode. And I've told you this before. I love you.
Oh, dude, Trina, I'm speechless. Oh, I'm so grateful to have you in my life. I am so grateful.
And me, you. Another thing that you and I resonate on is our love for cheerleading. And you know I was not going to forget this. So another thing that I want to do, sounds so bizarre, but we're going to get a group of us who were cheerleaders. And I swear, our kids are going to be so mad. But let me tell you, kids, we're about to go viral. But I would love to pull a bunch of us who were cheerleaders.
There's plenty of us.
Right? And just do every now and then get together and do some cheers. Okay, we don't have to do the jumps. I bet you can still do some backflips. Let's not pretend. And splits. But I think it would be the coolest thing. We gotta get our sweatsuits. Our tracksuits with our names on the back.
I love it.
But I think that would be the coolest thing. I mean, how much fun would we have?
Well, I shared, it's funny. I picked up cheerleading because I used to be a gymnast growing up. And as an 8th grader, the gymnastics club in Rochester just closed. And I was done doing gymnastics. And I'm like, okay.
Chapter closed.
Yeah, exactly. And I was getting ready to go into high school. And I'm like, actually, it was, I joke about it now, but it was devastating. That was my identity. Yeah. Just like I watch my own kids with, their identity as a soccer player, as a hockey player. And I get that. I remember I identified as being a gymnast growing up, and all of a sudden that chapter was closed. Yeah. And I'm like, okay, I'm too old to pick up sports and be good or competitive at the high school level. So I guess I'll be a cheerleader. and it was so funny because I still brought the competitive gymnast in me to cheerleading, which was not competitive when I started as a freshman in high school. And thankfully, I had a co-conspirator who also was a gymnast with me and my dearest friend growing up. And we both started cheerleading as freshmen. And I tell you, we turned into a competitive team and we went into competitions, started winning competitions, qualified to nationals as juniors. And it's so funny. We had a great squad.
That's awesome.
Proud of it. However, I will say cheerleading taught me one of the most important aspects of leadership. And it's something I carry with me to this day. And I really impressed upon the rest of friends and teammates on the cheer squad the competitive nature. And for some people, unbeknownst to me, they didn't necessarily want to be on a competitive team. They were there they were there for the other people and to cheer on the teams and what cheerleaders are supposed to do, really. And I just remember a few of them giving me that tough feedback that, not everyone wants to win like you want to win. Not everyone wants to compete like you want to compete. And you make some people feel bad That was so eye-opening. It was so eye-opening.
Right.
And I definitely have some guilt and remorse, but I was young and I didn't know. And I needed that experience to know today that if your team doesn't have a common goal, a shared goal, you're not going to function as effectively as a team. And so that's a good leadership quality that I learned through cheerleading.
See, cheerleading does some wonderful things. So many life lessons in cheerleading.
It's so crazy.
Oh,
But yeah.
yeah.